Hello everyone, welcome back to LIFEHUE YouTube channel. This is the third video of our complete general medicine series. In this series, we are going to cover theory as well as practical topics of general medicine. So in this video, our target is to know about these gastrointestinal and hepatobiliary system diseases like stomatitis and oral ulcer, gingival hyperplasia, dysphagia, gastritis, and peptic ulcer. Stomatitis is the inflammation of oral mucosa, in which disruption of mucosa may lead to ulcers. Here we will know about some common causes of oral ulcer. They can be infection due to viral, fungal and bacterial agents. Viral agents like herpes, CMV, EBV, HIV, fungal agent like Candida, and bacterial infection like Vincent's infection and syphilis. In Vincent's infection, there are painful, slogging deep ulcers which primarily involves gums. Dermatological causes like pemphigus, pemphigoid, and lichen planus causes oral ulcers. Drugs used in the therapy of chemotherapy drugs, erythema multiforme, Steve-Johnson syndrome. Systemic diseases like Behçet syndrome, SLE, systemic lupus erythematosus, and nutritional deficiency like vitamin deficiency of vitamin B and C and iron deficiency. Neoplasia like squamous cell carcinoma, leukemia, Kaposi sarcoma, and gastrointestinal diseases like Crohn's disease and celiac disease. Trauma due to dentures and corrosive and hot liquids can cause oral ulcers. Now we will know about gingival hyperplasia. It is the swelling or enlargement of gingiva. It can be generalized or localized. Causes for generalized gingival hyperplasia may be acquired or congenital. In acquired causes, we have acute myeloid leukemia, vitamin C deficiency, drugs like phenytoin, cyclosporin, calcium channel blockers like nifedipine, verapamil, diltiazem, amlodipine, and sodium valproate and tranexamic acid. Disease like Wegener's disease, which causes strawberry gums. Congenital causes are mucopolysaccharidosis, primary amyloidosis, hereditary gingival fibromatosis. Causes of localized gingival hyperplasia are also acquired and congenital. In acquired causes, we have lymphomas, multiple myeloma, squamous cell carcinoma, Kaposi sarcoma, pregnancy sarcoidosis, Wegener's disease, giant cell papules, which is due to primary hyperparathyroidism. In congenital causes, we have Fabry syndrome, tuberous sclerosis, Schrag-Weber angiomatosis. Dysphagia is difficulty in swallowing. It is divided into following types: oropharyngeal dysphagia and esophageal dysphagia. In oropharyngeal dysphagia, there is problem in transferring food from mouth to the esophagus, and in esophageal dysphagia, We have difficulty in swallowing down the food, the esophagus. Causes of oropharyngeal dysphagia may be mechanical or motor. Mechanical causes are oropharyngeal tumors, post-surgical radiation changes, Zancker's diverticulum, retropharyngeal abscess mass, thyroid disorders, Plummer-Wilson syndrome, and inflammatory lesions. Motor causes are brain injury, cerebral palsy, Parkinsonism, stroke, rabies, tetanus, cranial nerve palsy, Guillain-Barré syndrome, myasthenia gravis, botulinum toxin, myositis, and myopathies. Causes of esophageal dysphagia also may be mechanical or motor. In mechanical causes, we have esophageal cancer, peptic stricture, inflammatory esophagitis, Schach's ring, posterior mediastinal mass, aortic aneurysms. And in motor causes, we have atresia, scleroderma, diffuse esophageal spasm. Now comes our next disease, gastritis. Gastritis is a histological diagnosis characterized by inflammation of gastric mucosa. These are following types of gastritis: acute and chronic. Acute gastritis is usually erosive and hemorrhagic. It can also be due to infection. So we will first know about erosive and hemorrhagic type. Its main cause are drugs, alcohol, stress due to severe illness, congenital gastropathy due to portal hypertension. The treatment of acute gastritis consists of administration of sucralfate suspension and H2 receptor antagonists such as ranitidine. Uncommon type of gastritis may be granulomatous gastritis, eosinophilic gastritis, and lymphocytic gastritis. Now, peptic ulcer. They are present in the lower esophagus, stomach, and abdomen. Risk factors are Helicobacter pylori, NSAIDs, chronic obstructive lung disease, chronic kidney disease, coronary artery disease, obesity, diabetes, old age, and tobacco use. Treatment of peptic ulcer. In medical treatment, we use three things. Firstly, acid neutralizing or inhibitory drugs. Second, mucosal protective agents. Third, eradication of H. pylori. So, acid neutralizing or inhibitory drugs are our antacid, H2 receptor antagonist, proton pump inhibitor, and mucosal protective agents are sucralfate, bismuth, misoprostol. H. pylori eradication therapy is achieved with treatment in 85 to 90% cases. In this, we use standard triple drug therapy in which amoxicillin plus clarithromycin is given. Second therapy is bismuth containing quadruple therapy, and then non-bismuth containing quadruple therapy. This was the last of the video. In next video, we will learn about jaundice, acute viral hepatitis, cirrhosis of liver, ascites and hepatomegaly. After that, we will learn about diarrhea, dysentery, amoebiasis and malabsorption. Thank you for watching video till here. If you like the video, don't forget to hit the like button, subscribe to the channel for more such videos, and don't forget to share it with your friends.